walked into this hospital 26 years ago for an interview to be a nurse, and I'd already been offered a place at St Thomas's and King's, and I thought St Thomas's was a place for me because the view was so good. And I remember really distinctly walking in, there was no Marks and Spencer's then, but walking in through that main road entrance, and I thought, before my interview, before anything, I'm going to work here. This is my space. I loved it. And 26 years later, I'm never here. People ask me if I'm going to retire. That's not going to happen. I'll go on until I can't do it anymore because I love being a nurse, and even more since the pandemic. So my mum was a nurse, and one of my memories from being little, I think I was probably about 5 or 6. It was Christmas Day, and we'd driven back from my aunt's where we always went for Christmas Day, you know, one of these family routines. And we're on the way back, driving back, and it's dark and it's raining. And I remember my mum going, stop the car, stop the car. And I'm like, what's going on? And then she'd witnessed a car accident. She got up, she worked in A&E, she was a sister in A&E, got up out of the car and went and helped with this accident. And I remember climbing into the back of the car and looking in the window, and I could see flashing lights and people moving about, and it was raining, and it was so exciting. And I just thought, wow, this is amazing. It was really exciting. People running around. And my mum got back in the car and my dad drove home, and my mum had blood on her skirt. And I'm thinking, wow, no, it didn't shock me, it was amazing. And then I started asking about her job and her work and what she did, and she would come home telling me stories about what had happened, and this man hurt his leg, and this man jumped off a roof, and various stories, and it fascinated me, and that's what I was going to do. So I did travel quite a bit after I left school, and I didn't get the grades to get into nursing. I did the very last ever registered general nurse training before it became a degree. So I started my training in 91, went off travelling around the world, went all over the place, got back here and thought, no, like, I better do this. Went to night school, got the grades, and came along, got my first place in nursing. So I was a student nurse here in the olden days where you didn't really sit in a lecture theatre, you got on with it, you had a uniform on, you had your paper hat, your belt denoted how long you'd been qualified. And I worked on the wards here, and then I had one of my best experiences, and I worked in A&E here. I mean, it was casualty, then it was A&E, and now it's ED. I don't know why they changed the name on the signage, but it's now ED. But I think it was casualty going into A&E when I worked here. And I worked there over Christmas period, so Christmas is a good time for me, it seems. And I worked Christmas, and we had a man that had been stabbed, and he was 21, he came into A&E, and I was just in shock watching the surgeons come in. They'd all been at a Christmas party, and some of them had tinsel around their hair, the girls had tinsel in their hair, they'd been called because they were on call, so it was local, all came. And because this man was bleeding, they just opened his chest, someone put his hand inside the chest cavity, got hold of the heart and was doing manual resuscitation. I know defibrillator or CPR in the chest. Somebody else comes in, stitching the liver, all of this. He's going to theatre, and then the police arrive and say, where's he gone? I will follow the blood up the corridor, into the lift, follow the blood to the theatre. And then the guy's fine, and a few weeks later he goes home, and I'm just like, this is amazing. Right, I'm going to go and work in A&E. So my first job was on the orthopaedic ward, gunning, which is still gunning, but different now, looks different now, different staff. And then I went to grey ward, which was the A&E admission ward. And in nursing, they do this weird thing that you have to pay back every single hour. So there's a shift called a half late, where you come in at 4 o'clock and go home at 7:30. It's a bit silly, it's a bit of a waste of time. But I arrived, I've been qualified for nearly a year, and they asked me if I would go and get a patient from endoscopy. Now, in the old hospital, there was the Knightsbridge wing, and in that was the cardiac ITU and all the endoscopy. So I'd gone from grey ward, and it was the same day they were refurbishing the St James's lift lobby. So I had to go from endoscopy, it was miles away, all the way to Lanesborough wing, up the lift, and then all the way along the corridors back with this man who just had a bronchoscopy, which is where they've looked into his lung with a scope. His name was Geoffrey Clubb. He changed my life, this man. I will never forget his name. He was 40, he had a lot of lung disease, he had bronchiectasis, and he had this scope. And it was Friday afternoon, and I didn't feel comfortable. And from that moment, I've learned about the gut instinct of a nurse. Something wasn't right. But I had to. It was Friday, endoscopy was closing for the weekend. There was a secretary, and she said, I'll walk with you. We had a porter, me, and this patient on a trolley. And are you all right? Yeah, I'm all right. And we had some oxygen. I put some oxygen on him. We're walking along the Lanesborough corridor. And we just got outside St James's Theatre, and I looked at him, his eyes were at the top of the head, and he had a full-on cardiac arrest in the corridor. And at that time, since that event, there are now phones in the corridor, but there were no phones. All right, what do I do? Okay, right, come on, you're trained to do this, you can do it, A, B, C. And the porter's like, what can I do? What can I do? We get the oxygen, and my head is reeling with what I have to do. The secretary's helping us, and then I think, intensive care's on the first floor, I'm sure. I've never been there. Never did it as a student, I'm sure it's there. So let's push the trolley. I think, fingers crossed it is on the first floor. Push the trolley, and there was a glass door. It's no longer glass doors, and there was a sister standing looking like this as well, this on CPR on a trolley. And I'd done CPR before, but this was real life, it felt, in a corridor with a young guy. And she just went like that to me, this big gesture. We came in. She came out and got the trolley. They got this patient, scooped him in the bed. He was on the monitor, defibrillation, boom, boom, boom. Doctors coming in, putting lines in his feet and his arms, everything. And I was like, wow, this is amazing. It was like really slick, full on, some of the things I'd seen in A&E, because I decided after the event with the open chest, A&E was where I was going to go. That's where the excitement was. Anyway, I was quite overwhelmed. I went up to the ward, back up to Grey Ward. It's like, where have you been? You've been gone ages. And the family had arrived. So I took the family down to ITU. I explained to the doctor what had happened with me, where I'd found him, what had happened on the ward. And the doctor took the family, explained everything to them, taking in everything I had said, succinctly putting it all together. And then we took the family in, and I went back up, and I went home, and I couldn't sleep all night. I was full of adrenaline and just like, is he going to be all right? And I went in the morning, I was working the next day, and I came in early, and I went into ITU, and the bed they'd put him in was empty. And I thought, oh no, he's died, he didn't make it. And then the sister I'd seen the day before came along, and she said to me, oh, we moved him into the cubicle because he couldn't sleep. And I went into the cubicle and she said, Jeffrey, this is the nurse that saved your life. And he shook my hand. And she said that is the worst thing for a nurse who's not even qualified a year to go through that experience. And I said, because now I knew he was okay, I said, it was quite exciting. She said, what are you doing on Monday? Nothing. Right, come for an interview, I think you'd fit in here. And that was it. I literally went for an interview, got a job, and that was January 1996, and I'm still there. I have been part of the outreach team, which you might know about, which is critical care nurses and doctors who cover the hospital. I did that for 5 years. And then my next hat, I was just about, apart from a couple of bouts of maternity leave, about 10 years ago I was thinking, I'm an ICU nurse, I've got all the qualifications I need, I'm critical care trained, I'm trauma trained, and I got to the point in my career now that I can look after anyone who comes through the door. Anyone. Doesn't matter what is wrong with them. And actually with patients, it doesn't matter what your illness or your disease is, it's about system support. If you know how to resuscitate someone, you know the right thing to do, support kidneys, heart, lungs, then you can look after anyone. And I have looked after people who, there's banana boats on holiday, somebody came off that, went flying into the back of a yacht, had injured themselves. I looked after a woman who was attacked by a rhino on her honeymoon and been repatriated to Tooting. People who've jumped off buildings, people who've shot themselves, stabbed themselves. You might have heard about the the ride a few weeks ago in Brockwell Park. We have that man with us now. People who come off rides, all sorts of stuff. And then you get the mundane and all the other stuff, and all the people who go to Turkey for their gastric banding that doesn't work and comes to us, and so much stuff. And I got to the point I can look after everybody. What do I do next? And so we needed someone to sort out the recruitment because we were 40% vacancy. The matrons who run the unit didn't have time to do all the recruitment, and they wanted us to go to the Philippines and India and Europe. This is before the madness of Brexit, and get as many nurses as we can. So I volunteered to help. So I went to Dublin, and I went to Portugal and Italy, and I didn't get to go to the Philippines, but we got lots of nurses from the Philippines, and they sort of arrive in Tooting, which I don't think is a particularly nice place when you've lived in Tuscany. And you come here, and these young people who'd literally come, I used to say I've snatched them from their mother's breast. They were sort of young, they'd literally gone to school, done their nursing, come to London. and English is their second language, and I was looking after them, and I was helping them how to get what an Oyster card was and how to get a bank account. And you know, this is when you start working, it's a rabbit warren of getting lost. And so I started taking them under my wing a little bit, and one of the nurses, who's the mother of the twins you saw, one of the nurses started, I think it was a joke, calling me mama, mummy, mum. Oh, talk to Anthea, she's the mother, she'll help you with that. And then from the Oyster cards and setting up a bank account, there was, oh, whoops, my period's late, I might be pregnant, what do I do? I've had a fallout with my boyfriend, I want to get a day off for my grandmother's funeral and I'm on a night shift. So I started, I've got my own kids, I started sort of doing a bit of parenting on the side. And my office became a bit of a, oh, this is the crying room, because people come in, can I have a word, Muh? And I'm quite physical, and I would always just put my arms around them and hug them, you know. And it wasn't just the girls, it was the boys as well who would come, can I talk to you, and don't tell anyone. And so I didn't pass anything on, and I looked after these nurses, and I've seen them sort of get very upset and emotional. We get a lot of young death, things you can identify with, and it's very hard at work when somebody comes in, something horrendous has happened. We had a woman who'd been to a party, took some ketamine, never taken ketamine before, and then was terrified because there was a snake around her arm. So she went into the kitchen, found a knife and was cutting the snake off her arm. And of course there was no snake on her arm. But that's when you're the same age as a patient and you're looking after them, and you just think, you know, I think some of the nurses who've maybe done a little bit of dabbling, thinking, oh my God. And those people, you know, our nurses come to work on their motorbike, who then look after someone who's motorbike, and somebody who's messing about with a friend who's gone under a tube. We see all sorts of stuff, and when you're young and it's quite overwhelming. So this is where a lot of the crying comes from. So I had got to a place where I felt I could look after anybody who comes through the door. I've done CPR in Sainsbury's, in the tube, on the road, and I'm quite chilled about it because I know what I'm doing. I can get everyone else to do it. And we've had all sorts of disasters at work, and you may have a member of staff something happens to, or you know, cardiac arrest, Marks and Spencer's. So I was getting a bit itchy feet, right, what can I do now? I love nursing, but I need something else. Got into the recruitment, got to sort of look after these nurses, got to be this sort of temporary mum to them, and then there's a pandemic, and I tell you, you guys probably were working from home. You can't really sort of do CPR by Zoom or mop up poo on Teams. So we were here, and it has changed overnight. My parents live in Dorset, and I've gone down to Dorset, and I came back to work for a normal shift, and so we have an ICU on. So how it works here, in case you don't know, there are 3 adult intensive cares. There's then paediatric intensive care and neonatal intensive care. Adults and children are completely separate. We do not cross over. Even if you have, say you have an 18-year-old with learning difficulties, probably more appropriate to be in paediatrics, but may come to us. That's the only time we overlap. We don't look after children at all. So we have the 3 adult units. There's a cardiac unit. Now, years ago when I worked here, they did all the cardiac transports. They don't do that anymore, but they do a lot of elective cardiac surgery, massive. They then do all the cardiac trauma. People, you know, gone off a motorbike and got handlebars in their chest, out of hospital cardiac arrest. They've had teenagers who've fitting well, school playing football, and boom, they go, the heart problem. So they deal with all that. Neuro is brain tumours, bleeds on the brain, head injuries, a lot of organ donation goes on neuro, and general, which is where I work, is just a hodgepodge of everything. You know, you've got the post-operative patients who need to come to us. You've got a lot of obstetric things when you have a big bleed or something goes wrong with obstetrics. Everything. We're just everything else, which is why we're called general. And I came to work, and we didn't have 3 ITUs anymore. We had 7. And we don't in cardiac theatres, and that was an ITU, and endoscopy was an ITU, and where we had a side room for a patient, there were now 2 patients in that side room, and you were climbing over the bed of one patient to get to the other. And not only would he had all these ITUs that had just sprung up from everywhere, we had no visitors, and it made me realise how we get to know our patients through the visitors. So you get very connected to family. We've had a young girl recently, sadly she's died, she came off, she was recycling and had a plastic bag, which I now, when I see people, please don't do it. Put a plastic bag on your handlebars, cycling fast down a hill, no helmet on, and the plastic bag gets caught in the wheel, and the bike just stops. And so she went catapult, hit her head. She's a female pilot, qualified pilot. And she was with us 7 months, and we were trying to do everything, and she just kept going up and down, up and down. And the mum sent me, messaged me the other day, you do end up giving your phone number to these patients, or the family sometimes. Never once do they ever abuse it. Saying that she misses us because she got to know our name, she'd seen pregnancies develop, she'd seen people go on holiday and come back and come tanned, and 7 months. And we got to know about through her daughter, what her daughter did, what she likes, you see her friends visit. So you get this close connection with the patients. So in the pandemic, we had no visitors, so we didn't know who our patients were. Most of them were prone, which they're nursed on their tummy, which looks quite alarming when you've got someone like this face down. People, you know, it's not a clean area really. When people are in hospital and intensive care, they dribble, they vomit, they wee, they poo. We do all of it. You know, I fish tampons out of people from accidents, I pitch contact lenses out of faces. And sometimes families say, what happens with her period? What happens when they poo? We do all of it. We cover everything in the most dignified, kind, empathetic way. And that is nurses. The doctors are great. We can't do that to nurse doctors, we do it as a team. But I'm a nurse, so I always talk for nurses. So in the pandemic, I've got this new mother role. We're all over the place, and we're wearing PPE. Now, wearing PPE, and do you remember how hot it was? I wish it was hot this year, but it was hot then. And PPE, so we wear scrubs. So you've got your underwear on and your scrubs on top. And then on top of that, you put a blue plastic sort of gown on, which I discovered are exactly the same as shrouds, except they're blue and without the frill round the neck. They are the same fabric, they tie in the same way. So you put them on, and then you put your FFP3 mask on, which should be fit tested, but we didn't have time to do that. So we put the mask on, and I wear glasses when I'm working, so your glasses steam up. You then put this like J-cloth, like wearing theatres, over your head, and then later down the line, a friend of mine started going mad. She set up a group called the London Scrubbers, and they made fabric hats, and a lot of people still wear them. So if you see anyone in a floral fabric hat, that's from that. And then you've got your visor. You might have one of the hazmat suits on, which has a hood on it, and trying to work like that in that heat. And that was when we didn't really understand COVID, so we couldn't have the windows open in case COVID got in. And it was like working bubbles, because the wards, most wards here at St George's have a little bay with 6 beds, 6 beds, 6 beds, but they'd seal all up the openings to the bay and put doors in that weren't normally there, but you couldn't come out, so you go in and do your work. And they had runners, so we had people redeployed from other areas. So I was with a friend once, and we had turned a patient who had been proned, and he had pooed everywhere, and we were clearing up, and I said to one of the guys, can you pass me an Inco pad? And he, what's that? Show me what it is, because they're very geeked out. And I said, well, where do you normally work? IT. So he'd come from IT, and then another nurse, every single person seemed to need insulin. So I said to her, can you just draw up these 10 syringes of saline, put that right on these labels, do that, I'll check it all. And she said, well, I'd love to, but I don't think I'm allowed. I'm a hairdresser. And we were at the beginning, people were just walking off the street. We got into a bit of a swing with it. But I worked with a dementia care specialist, somebody who worked in endoscopy, somebody who worked in A&E, new nurses worked on the wards. Suddenly student nurses had to become qualified nurses, which didn't make any sense to me, because when I was a student, I learnt on the shop floor with the patients. Now they learn in a university where there's no patient. So by the time they're walking up sick, they've talked about sick in lecture theatres like this, but not do it. You can't. It's an apprenticeship, I think. For me, you get your hands dirty, you get on with it. That's how you know whether you want to do it. And it was just like an extraordinary situation. And there was one particular day, you know all the supermarkets, your queues. We couldn't go to prep. Prep just shut down. First of all, it wouldn't nurse you if you were in scrubs, because they knew you worked in ITU. They wouldn't service in Marks and Spencer's. And I got to work once, and there was a nurse with 2 yogurts in front of her and cheese and biscuits. And I said, what are you doing? She said, I've got no food in my flat. I can't buy any. I went to Sainsbury's last night. I was too tired. The queue was round the block. I can't. I've just got to eat something. And I thought, this is mad. And we had a really awful day. 15 people died. Many of them were young. We had a 23-year-old die. And I'd have all my friends saying, "Oh, what are you doing?" And it's like, and we're in lockdown, and you look on Instagram and people are making cakes and doing jigsaw puzzles, and it's just like really weird. And there's no one in the hospital. And I think that was when I learned about what we were talking earlier about Sue. There's many people that keep the big ship St George's afloat. It isn't just the doctors, it isn't just the nurses, it's the people in the mortuary, especially during COVID. The people doing all the endless swabs, blood bank, the organ donation staff, the IT staff, the occupational therapists, the speech therapists, radiology, and all of you guys who hold it all together. But a lot of people working from home during that time, so it was a bit odd, it was a bit different. So one night was just particularly awful, and I found it very difficult being someone who could cope with anything. Nothing fazed me. I'm a marathon runner. I thought that's the biggest thing I'd ever done. I've got my children at that time were 21. My daughter was doing politics in Bristol. She was in her second year, and my son 5 years younger, so he was a teenage boy. And it was quite hard getting home from all of that was going on here and going home and my son saying, "Where have you put my tennis racket?" And you know what young boys are like, and the house was a mess, and my partner was absolutely superb and just took over everything. But I found that movement from work to home extraordinary because it was so different. And I sort of got a bit involved with the whole crying thing. And at work I just remember people were crying, and you would see all this immaculate, all the Spanish Italian nurses always have got immaculate makeup, and you just see all these little lines under everyone's eyes. And then we have a superb consultant. He's left, unfortunately. He's in the army, and he's won lots of awards, and he runs HEMS, and he's been on the comms a lot because he's an amazing guy. And he was saying he was sitting in the office, and he was just sobbing, and a medical student walked in and was like, "Whoa," and walked back out again. So it really hit us all hard. So I went home, and I was sitting in the garden one beautiful evening, and I thought, what can I do? Because I'm a doer, I'm a fixer, I'm quite practical. And I couldn't do anything, so I just wrote an email we just had a street party for some royal event, I can't remember, but I've got contacts from ballet groups and football club and gym for kids and the local school, and my kids, 2 different schools that my children have been at, and lots of people. So I wrote an email, took anyone medical off it, and I sent the email, and I just said, I'm a senior nurse at St George's Intensive Care. Part of my job is recruitment, and we are really struggling at the moment. And the European nurses and the Irish nurses I work with go home all the time. They do a stretch of nights, and then they're home in Italy for 4 days, and they bring you back some sort of parmesan or olive oil or something local, and I had got close to them, so they'd always bring me little gifts. And then I got to the point where their mums would send, "Oh, this is a present for you for looking after my daughter," and it was really nice. So I felt a bit of responsibility to these kids that I called them at the time. Anyway, so I wrote this email. I didn't really think anything of it. Wrote an email saying it's really awful. We'd gone into lockdown, but there was a shortage of flour and stuff, wasn't there? And this is when toilet roll gate was happening. And I wrote this email saying, if any of you got time, if you could make some cake or biscuits or chocolate brownie and drop them at my door. This is my address, and I was sending it locally. This is my address, this is my phone number. Well, I put your address and phone number on something, and boom. So I was at work, and I got to the point where I worked part-time. I just felt really anxious at home, so I'd go to work. So I just got up in the morning. Do I feel like going to work? Yes. And I'd just appear at work, and a lot of staff did that because we couldn't bear to be at home. Because if you were at home, you were in the wrong place. And it was awful, because we had intensive care is 1 nurse, 1 patient, and you're busy. And this time was 1 nurse, 4 patients, or 3 patients, but you've got your guy from IT helping, and your hairdresser, and somebody who's a dementia care specialist or an endoscopy nurse. So they're out of their specialist area. And you may have really senior people, the respiratory CNS, he's really senior, working in COVID with prone patients on a ventilator. She didn't know. So it was a real hodgepodge of people. But I was at work one day, and my son kept texting me, and I wasn't looking at my phone, and then he rang the main desk, because I've given them that number for emergency. What is happening? I'm on my PS4, the door keeps going, people keep bringing in tins and boxes, you can't move in this house. Anyone who's got a 14-year-old son or brother that knows. And I was like, okay, people have made biscuits, this is really nice. And when I got home, I don't have a small house, and my hallway is about this, I couldn't move. The local shop had heard, so they bought masses and masses of boxes of crisps and biscuits. We had cakes, fruit, everything. It was ridiculous, and it took me 3 trips in the car with a friend to go backwards and forwards to bring it in. I've got a photo of them with the whole thing piled high, and we couldn't eat all of it, so I took it to cardiac ITU, neuro ITU, and then I took some to the mortuary. Oh, everyone forgets us, and the blood bank, and everywhere. And then I wrote a message saying thank you, this is incredible, it's amazing today, we're wearing PPE and it's really hot outside, and some of the nurses are hanging their hands out of the windows just to get a bit of coolness and then shutting the windows quickly. And today we had 12 deaths and it's very overwhelming, and a lot of the nurses are crying, and it was very difficult to recognise people sometimes. And I went into a bay one day, the 4 nurses, and they'd written Beyonce, Taylor Swift, all over to try and get a bit of fun, to try and do something to lighten the load. Anyway, the food tsunami kept going and kept going and kept going. And a friend of mine said, right, this is ridiculous, you cannot live off cake and biscuits. I am going to go on Thursday clap. She's got 4 sons. She sent me a photograph on WhatsApp with buckets with bamboo on the end, and they went up and down the streets during the clap collecting money, and they got about £300. And people were asking, what's the bank details? We'll do a transfer. So she set up a PayPal fund, and it was really funny because she put a goal of £2,000, and she got £475,000 over the year, and it fed us for 3 meals a day we had throughout the pandemic. Even when it stopped and came back up, it came again. I then had a call from the chief chef at the Dorchester Hotel who said, my next door neighbours forwarded me this email. We've got fridges and freezers full of things. Could we make you some cheese scones and bring them in? So they came in with the Dorchester van, all dressed up with their outfit on. Oh, and I don't know if you watch MasterChef. MasterChef had just finished and Thomas Freight won, and he rang me and he said, well, I'm not doing things, so I'll do some cooking, but also the Dorchester bring us things, so I'm going to come and help him. So he's running up and down the stairs with trays of food and lasagnas and everything. And then they brought in pizzas one night, and then they said, how many pizzas would you need? And I said, as many as you want to get. So he said, well, order 100 pizzas. So a neighbour saw them piling 100 pizzas into a car. It was ridiculous. I do have photos of all these things. And delivering them. And they said, oh, we'll do a Chinese tomorrow. And it went on like that. And then I get an email from, hi, this is Richard Branson. My cousin sent me this. I think this is amazing. What's the PayPal link? I'd like to send you £10,000. And then I was putting that the way I was dealing with this was running. So then Mel B contacted me by WhatsApp. I'm Mel B. I hear your story is amazing. I forwarded this to all my friends. They've got the link. I'm sending you a running jacket because I can't think of what else to give you to say thank you. And this thing sort of escalated. It became mad. So then I had a call from Susanna Reid on Good Morning Britain who said, would you come in? Now, during all of this as well, my daughter was at home doing nothing and moaning about doing nothing. I said, well, come in and help. So my daughter came, 21, politics student, came in and was a ward clerk and answered the phone and spent ages looking for lost dentures and started this whole thing. I brought my iPad from home, logging in and doing FaceTime with family, and she would lean over the bed for ages and she saw all sorts of things she had no intention of seeing, and she would say to me, I'd never do nursing. And this is somebody who, when I talk about work at home, she goes, la, 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 I don't want to hear. And she was phenomenal. And it was the tiny detail. You know, an elderly man had lost his bag because there was no system with property, and so she went down to A&E and it wasn't there, so she went to the ward and she found it, and she came back, she said, I've got your phone, I've got this, all he wanted was his dentures, you know, and it's just different priorities. So Good Morning Britain asked us if we would go on Good Morning Britain, but it wasn't. It was a laptop balanced on top of a storm lamp in my sitting room, trying to get an angle, speaking to a blank screen about this nurse who seems to have started a wave of people giving food to nurses during the pandemic. And I got on to Good Morning Britain, and they sent me some money, and then someone else gets some money, and then someone called Prince Charles contacted me and said that his physician had been reading my emails, which I kept sending, and you get to the point where you can't say thank you anymore. So they published everything I was writing. So I'd be writing about today we had someone of this. And we had a man who'd just gone over booze, a Jamaican man with some Jamaican punch. And everyone's got COVID and he doesn't. He's sitting cross-legged in bed with a pineapple hat on his head. This is fucking stupid in here. And I would talk about things like that. And obviously I'd change names and situations to make it, because the patients are the most important thing, to keep confidentiality. But the stories sort of, I kept writing emails saying thank you and stories, and then I would get another load of donations. And one Sunday my friend said, "You've not written anything for 2 weeks, we need more money." And so I just went, and I did all of it on my phone. And I'm not one of these young people who can do it with 2 hands, so it's like this. So I wrote that whole book like that. I've written another book just like that as well. I didn't even bother with the laptop. So I'd whiz out an email and she'd text me, "Oh great, that's another £7,000, thank you." And I just got waves and waves, and it fed us, and I told the stories. And then someone rang me up and he said, "I'm a ghostwriter, I work for Offater, I've done all his cookery books, I've done some for Rick Stein. You need to put these emails, they need to be published." And I think what I did unwittingly, and while I was trying to support my team, my staff, my nurses who I felt a responsibility for, I was telling the story in the middle. So we all would sit and watch the television, hear what the Prime Minister Boris was trying to say, and all the Patrick Vallance and Chris Whitty and everything they were saying. And I used to get really irritated because the then Secretary of State, Matt Hancock, was saying what we need for the pandemic is more ventilators. We need more ventilators. Well, it's fine. You have as many ventilators as you want. You want the people to operate them. And it isn't doctors. People think doctors operate ventilators. Yes, if you're an anaesthetist or you're a respiratory doctor, you can. But an orthopaedic surgeon, a vascular surgeon, or someone who works in a sexual health clinic has no reason to need to look after a ventilator. The people who look after ventilators are nurses. Nurses who earn the same amount as I give my cleaner each week, who are not appreciated, who are not valued. And by mistake, I very luckily was able to show... Sorry, I talk too much. You have to stop me. Was able to show... It all happened by mistake. These emails were about what we were doing. I was telling the middle story. You all know how it was, and I think it was quite hard for people working from home, shut inside. Some people really enjoyed that time and that opportunity to be with their family. But if you live on the 17th floor and you're a single mum of 3, I think it was probably much harder than if you're a very happily married couple with lovely children and a big house. I think it was very different for a lot of people, and it was really, really hard for them. And I was telling stories about, we had a man who came in. I mean, there were things like the ambulance would go to get one member of a family and bring in 2, and they were both dead when they arrived. And for nurses, for me as a nurse, it's about caring for people, looking after them, doing the added extra for them, but also about giving people a good death as well. And looking after people at the end of their life is sort of a privilege, and all of those things were wrong. And you'd have a patient die, and okay, move him over there because we need to bring in the next one, and it just sort of went against the grain for all nurses. And one of the worst things that happened to me in the pandemic, which I wrote about, is that I started working about 7 o'clock, and it was 2 o'clock, and I was really thirsty and my head was banging and I need to go for a break. And we just tried to resuscitate one patient unsuccessfully, and another patient had died, and there was another patient who was a nurse in a different department who I didn't know, who was trying to climb out of bed, who was very confused with COVID, and another man that had COVID who was really sick and trying to die. And the 2 patients that died, I moved their beds because I wanted to give them some compassion. I wanted to show something. I wanted to, and when anyone died, I'd always hold their hand. I didn't know them, I didn't know their name, but I did. No patient in the pandemic ever died alone. And we then moved the beds over, and I went and had a drink and went to the loo, because every time you went out, you did go to the loo and have something to eat and drink because you couldn't come in and out. And I went back and someone had moved one body there and one body there, and I didn't know which was which. And they didn't have name bands on, and I was freaking out. And somebody said to me, well, it doesn't matter because the relatives don't get to see them in the pandemic. But to me, it mattered so much. I need to know which was which one. I had 2 names, 2 bodies. They both were middle-aged men who were fit and well. They both got COVID. They both died. Families couldn't see them. And it freaked me out, and I was running up and down the ward saying, does anyone working in Bay 2 yesterday who can come and see these men? And there was a nurse, and she was like, I think that's him, I'm sure that's that patient and that's that patient, but I don't know, I think it's that one. And I'm thinking, my God, how is this we've got so bad that I work on intensive care, we can make people survive and go back to a normal life when they've gone underneath a tube, but we've got two pair dead bodies here and we don't know who they are. Anyway, we washed and rolled and wrapped one, and the porters wouldn't come and get the bodies at that point. They were frightened, so we had to take them out into the corridor, and they're all out there wearing PPE. Understandably, they don't really know what's going on. I mean, everybody just did their absolute best. And then when I rolled the second patient, there was a name band underneath him, and that correlated with what the other nurse said. But still today, when I'm having a bad moment, I think, I hope I got them the right way around. I'm pretty sure I did, but... Anyway, so... that's my story, really, and I'm still here, and I still love it, and I love nursing, and now I try and be as strong as I can. If any of you are on Instagram, I have an Instagram which my daughter started for me called Life, Death, Biscuits, which is a book. Is all of the stories, unedited, so the writer put everything together and wrote like a fictional story, or a fact. And I read it and thought, no, it needs to be how it was or not at all. So this is very unedited with lots of blood and guts in it. What's hilarious is that my team have not read it because they can't. So it's very funny when I go on, I was on Channel 5 recently on the COVID inquiry, because they now ask me now to go as a voice for nursing, because some of them have realised that actually the nurses were quite important in the pandemic. And it's nice for me to do that, and people say, oh, your book's quite revolting. And when I went to Audible to read it, we had to keep taking breaks because the guys said, your book's disgusting. You keep talking about poo and fluid. So all it is fluid. It is all it is. There is a lot of fluid. A lot of stories about death and dying, but also the lovely bits in between. The hugging. I mean, when I stand back now and I go to work, it's like arriving at a dinner party, because that's not changed. The nurses are affectionate with each other. We're affectionate with as a team, and we do the added extra. And at the end of when we come out of the pandemic, there was I looked after a patient. She was 45 and had breast cancer. She got through the breast cancer, gone for a scan, and there was cancer everywhere. And she had a very particular cancer in her lungs as well. So somebody who'd been fit and well a few years before, and her specialist told her that she probably had about a year. So this was 4 years later, so she had lived that extra 4 years, and she came in with us. And the good bit, you were saying about silver lining, is now I feel we can do anything. And she had been spoken to by the oncology team, by our doctors on intensive care, and we got to the point, so when I need to stop, got to that point, and she said, I don't want any more treatment, I don't want to go home. My children were sort of late teens. I don't want to go home, I just want to stay here. And I said, is there anything I can do for you? And she asked me if I'd wash her hair, which I did, and then she said, I just miss my dog. I just want my dog. And her husband said that when she was being sick with the chemotherapy, and when she was really ill and really unhappy, the dog was her comfort, would sit with her in the bathroom, would lie on her bed, would follow her, and that was the one constant from her cancer journey. And I just thought, you know what, sod it, let's get the dog in. Oh, you can't have dogs in hospital, I mean health and safety, you must speak to infection control. I thought, no. We went through a pandemic, we are nurses, I wrote a bloody book. I was in the bottom set for English at school, but I wrote a book. And I got the dog, and the dog came in, and she died with her dog lying on her. And to me that's nursing. And I saw at the Marsden that a horsewoman was dying of cancer, and they took her bed down the car park and brought her horse in. I thought, I don't even have to read that, that'll be a nurse. So nurses are fantastic, they're brilliant. I mention that a lot in the book. If you want, the Instagram is called Life, Death, Biscuits. My daughter started it up for me, and it's actually been incredible because it talks about nurses. And what I do is I celebrate, it starts all about COVID, and there's lots of pictures about COVID and how the patients are, and the hospital were a little bit nervous about me at the beginning in case I said something dreadful. But I never say anything bad at St George's. From the first moment I walked into this hospital, I knew it was the place for me. I was here in the pandemic. I'm proud of the pandemic. The pandemic was the most hideous, terrible time for everyone. Everyone suffered. And I was working in a hospital that was empty, but a massive hospital like St George's with so many staff. And the hospital works from the top down. The senior people that have all their lovely offices, they've got their beautiful photos on the board near security. They make all the decisions about money and what we should and shouldn't do and how many nurses. Then they're all working from home. So in the pandemic, the hospital ran from the inside out. And we ran it, the nurses and the doctors, as a team of equal people. And it was lovely because sometimes I get frustrated with doctors because they sort of comes across that they know everything, but they actually don't know everything. Nurses know a lot. We don't know everything. And my daughter, who comes from Bristol, who does everything she can do and worked in the pandemic, and the porters were superb. And I was telling you earlier that we wanted to use the iPad because the hospital decided if you want to use an iPad, you got one click and you could see. So first of all, they were never charged. Secondly, it wasn't one click, it was about 20 clicks. And trying to explain on a phone to an 82-year-old to get onto Zoom and to make an account with this, that or the other, or Teams because it's encrypted, it was just ridiculous. You need to speak to somebody you love and you need to do it. So we all used our phones, and I just got a new iPhone before the pandemic, and I taped my iPhone to a drip stand, tipped the drip stand over, wedged it up with nappies over the face of a woman who's 42, so that her twins and husband could see her before she died. And then there was the most horrible situation because she had died and they're all talking to her, "Mum, you can do it, you can do it." And I have to stick my head round this thing that I've set up with my visor on and say to them into the phone, "I'm sorry, she's gone." And they're screaming down the phone. For the next half hour, I had tinnitus from them screaming. And then the guy from IT comes and says, "Oh, you can't use your own phone." And it's just ridiculous. And so the good thing about the pandemic, it's made me, we just can do it. I do swerve the rules sometimes if they're a bit silly, but people dying with their dog on them to me is important. And it's important, and we should look after our staff. But the hospital, all the people that are unseen, like switchboard dealing with the calls, they were the ones sort of putting the calls all the way through. I don't know whether they were doing it from home or here, but they were still doing it. The mortuary were incredible. Now there's I don't know if you know that, this is the largest mortuary in England. It's 198 fridges and freezers down there. There is a whole room dedicated to an obstetric freezer. That's quite horrific that they have a whole room dedicated to women who are pregnant or die in childbirth. There is bariatric fridges because when somebody is super large, they might not necessarily go into one of the fridges. There's a paediatric fridge. There's a neonatal area. I mean, it's quite alarming. And, of course, there were not enough fridges during the pandemic and it was hot. And I can't remember his name. Robin is his first name, runs a mortuary down there. He is a phenomenal man. And I wrote a bit about the mortuary in my book and asked him to read it. And he showed me around down there. And I'd been down there a lot to take bodies. And he said he came in after a bank holiday weekend and people piled up on top of each other and it just wasn't okay. So they sent a lorry to take them to a temporary mortuary out in Dockland somewhere. And they came and they were just putting them in the back. And he said, "Take them out, these are people. I want them individually put in, individually with their name." And he really fought to recognise the people as individuals. And I think, this is a massive hospital, there's a lot of people, and it doesn't work if one bit of the cog is missing. So everybody adds an amazing part of it. And the pandemic was horrible, and many, many people died who shouldn't have died. And there was a point where people may have had a chance to survive if we had known what was wrong with them, because at the beginning you didn't really know what was going on. We were a bit more with it in the second wave. But I worked with some pretty incredible people from ward clerk through to consultant, and we're all still close and connected now. So my Instagram has lots of pictures of working in intensive care. It's only about celebrating the hospital and what we do. I don't say anything negative. I might sometimes feel a few negative things about it. There are a few jibes about the intranet and the Wi-Fi, which was a bane of our life during the pandemic. Can't get onto WhatsApp if the internet's not working, and it's FaceTime that kept us going with the families. So yeah, that's it, my story. I'm still here, I'm never going to go. I live in Balham, so I always say to my colleagues, I'm going to end up in that mortuary anyway, which I think is so brilliant because I live locally. Might as well just hang on in here. So I'm still running, still working, still recruiting nurses, and I have made a remarkable amount of friends. And the only thing that's different is my friendship age group has just plummeted because all some very, very special people in my life are half my age. And yeah, that's it. So please ask me questions. Yeah, thank you.
Thank you so much, Anthea. It's such an amazing story, isn't it? I mean, when you came and chatted to me in the library staff room about it, I thought, we will all be wowed, and I think we're probably all wowed, a bit overwhelmingly wowed.
Well, sorry if it was a bit revolting, but
not at all revolting, very moving. Yeah. Anyway, has anybody got any questions they'd like to ask before we let Anthea run away?
Thank you. Didn't expect a microphone. Thank you so much for sharing your story. It's fascinating. Quite close to home in some areas for me. My mum's a nurse, or she was, and my partner's a junior doctor, so I remember hearing the stories about the pandemic vividly. I just wonder what you think the legacy of COVID-19 has been in healthcare now that we're through the other side of the pandemic.
I'm not sure really. I think there could be a better legacy than this had. It's amazing to me how we just move forward in some ways. In a hospital, we haven't learned from it. We're just back to normal. We haven't got more nurses. We're not respecting healthcare. As a nurse, we've not really had any pay rise or anything. My team, it's made us closer, and it makes us feel that we can do anything and make anything happen for any patient if we can. But there is much more that could have been done, sadly.
Thank you. It was a fantastic talk, and you're clearly a very brave woman. And I'm kind of concerned about asking this question because it's going to show what I am. But so initially,
I'm not brave. You just get on with it.
Initially, some of us had to come to work, and I remember being very scared, and everything was empty. The roads were empty. We didn't know what was going on, and I used to get home and undress in the porch. Kind of.
Yeah.
So
did I.
What was your experience with that feeling? Were you scared? Where did you stop being scared? And what you have to say to other people about fear?
That's an interesting question, because I remember during all of the time I was interviewed by a radio station. He said, what do you think? What do you think about the government having parties? What do you think about this? It's like being out in the middle of the ocean with a hole with boats, with a boat with holes in it, and you're bailing out, and you just got on and did it. I remember saying to my daughter, if you come in and help, this has to be your decision, because I don't know whether we will get this and die. But I was a nurse, I had to be there. I was scared, but I sort of parked it. And it was like being in a boat with holes in it. You don't have time to think, we just got on and we just did it. And looking back now, so I went out recently with for a meal at one of the houses with 3 of my senior colleagues, because we worked together, and we went for a meal and we started talking about the pandemic, and we all were crying. Now this is several years later, so it's affected me forever. I'm a better person and a stronger person because of it, but I still find it very difficult to talk about it. And even reading on Audible, I never read my book, I had to read it, I couldn't read it again. And my colleagues, as I said earlier, haven't read it because it's too triggering for them. But I'm a doer, and I just got on, and I just think I parked. I was more worried about my daughter getting it and how it was going to be. It was not knowing when it would end that was the thing that I found was spooky. And I think we were all scared because we didn't know. But that was my job. I was senior. I had to do it. There wasn't a choice, so I didn't think about it. I just had to do it, and I was exhausted, and I cried a lot. But I cried more during the pandemic than in my entire life. But I think that was a good thing to do. But it was scary. And I don't know, did I park it? But it did feel like you were in the boat and you were bailing out, and you were so busy bailing out you didn't have worry. A lot of times I just thought, when is this going to end? Is it going to end? Are we going to live like this forever? and I love it now. I was at Heathrow Airport this Monday picking up my son who's been off travelling for 4 months, and I just thought, I love it. It's people, it's squashed, it's noisy, and I don't think I could ever put a mask on my face ever again. I can't. Ben Weir is a cardiac ward here, and that was one of our temporary ICUs, and we have had a really lovely young mum in recently who's been very, very ill. She's now at home and back to normal, and she hadn't had a shower for 6 months, and I said, you know what, I know a ward in this hospital where there's a wet room, so I'm going to take you there. And we loaded up with conditioner and everything. This is something I wouldn't have done before, but now I'm like, right, this woman wants a shower, we're going to do it. And we went into this room and I washed her and scrubbed her. I washed that woman's body like it was my own body, and I did her hair and everything, and she texts me now, she's the best shower she's ever had in her life. And afterwards I bundled up all the gown and the sheets and the blankets and towels, and I covered her because I didn't want to get cold, and I took it down to the sluice, to put in the sluice, and as I walked into the sluice I started, I was like not a panic attack, but I was like, and it was all coming back, because the ward is functioning and it's a normal ward, but to me COVID is impregnated into the walls. There's a smell of COVID, there's something, and I could see all the rushing about in PPE. It was all very blue and grey. Somebody contacted me during the pandemic, and sorry, I've got a bit off your question, but asked if they could draw me use an artist who wanted to make, as a thank you for everything I was doing, draw me a picture. And he said, would you like mountains, hills? I said, no, I want you to draw what we have, what we're doing. And he made the most incredible painting, that is somewhere on the Instagram, of a ward and he did everything in water, with water coming through, because it felt like a tsunami to me. It felt like we were wading through water, and it's the most beautiful painting. So he's gifted it to St George's. It's a massive painting, but they don't want it. They say it makes the pandemic look worse than it was. So if you have a wall anywhere here that you want it, you can have it. It's already been valued at 10 grand. It's mine. It's for St George's, but they don't want it. So
who knows? Who's in charge? Who's in charge of painting?
it's beautiful.
I'm going to lighten the mood because we got very serious. But you mentioned all of the food items that you were given, and obviously there were probably some very dark days. Which food item were you given that was just the best thing you ever tasted, or really restored you on a day when you were low?
Donuts.
Okay, thank you.
Because the jam squelches everywhere. But getting food out of boxes in the Dorchester were great. And when we had my book launch, some of the people who donated the food came to the book launch, and I'd never met them really, or we'd been in PP, and a lot of my team were there. And she came up, she said, will you sign my book? I'm the lady who made the white chocolate brownies. She's the one that did it! And they were over, thank you. So there were very much preferences for some of the nurses. But the nurses are quite annoyed with me because they say they're still carrying around extra kilos. Because breakfast, lunch and dinner went out. You know, if you wanted brownies for breakfast, that's what you had for breakfast.
Any last question before we move seamlessly towards the bar? Lovely. So thank you, Anthea. You've made me feel very humble, actually, and very inadequate in a way. I mean, we did come in, and Roz and I got the library going and had our social distancing, but your stories just show the great kind of depth that we have, I think, to people like you across the...
and we were lucky we didn't have social distancing, so we could be together.
I'm not sure that's very necessary.
Well, you know, I think it made me realise people are important and touch is important.
Yeah.
And we touch each other a lot. I know there's inappropriate touching, but at work you do touch your colleagues. You might say or give a hug, or we are quite tactile, and in nursing particularly. But we used to do a lot of hugging at work because we needed it.
Yeah.
And that was nice.
And I think that I feel more inclined to touch now than I did pre-pandemic. I think that we did have that gap in our lives where we couldn't do those things. So thank you. It's really a fantastic talk. We think we've recorded it. Not sure. Did we get any photos? Did anyone take some photos? Yeah, we've got some photos. So we can put them on Instagram. Or put them on your Instagram. And I really recommend the book. It's a really,
It's a bit dehydrating, apparently.
but it's compulsive. Once you start reading it, you can't put it down.
Have you actually read it?
Yes, I've read it, and you have to just keep on reading it. We have got a copy in the library, so do come to the library and borrow it. Or, I mean, I think I bought it on my Kindle.
How much is it?
I don't know. I've never bought it. This is the only one I've got.
Come to the library and borrow it, Brenda.
It's on Amazon. I found it in Asda once. That was my best moment. I'm in there filming in Asda. Yeah, no, it was everywhere for a while. It was in Sainsbury's, Asda. It's just on Amazon. It was at Waterstones for a while, but I think it's...
If we bring you a copy, will you sign it for us?
Of course I will. General Intensive Care, first floor, Wednesday. I'm always there Tuesday, Wednesday, Friday.
It's a very small thank you. So it feels a little bit small
No, how
compared to
lovely.
our day almost done. Before Anna says the last bits and we do actually get to the bar, I want to thank everyone for coming today. I always think when we organise these days, is it worth it? And actually it's massively worth it, just because everyone's been here. So thank you very much for being here.
Thank you so much. I mean, I don't know what I have been so moved by the talk. I don't know what I can say after this. Not much. So thank you so much, Anthea. And thank you everybody for today. I hope you had fun. I hope you enjoyed it. It has been a fantastic day. It is day for our professional and technical services staff. And I hope you can enjoy a good drink or two upstairs. But before we finish, yes, some flowers too. So massive thanks to Sue and the team. I know you worked incredibly hard to put this for us, and it's been amazing. So thank you so much. Of course, we expect the repeat.
Depends what city you want, doesn't it?
We couldn't get through the day without
No, we had a bit of a drive. But,
yeah,
please do join us in the bar.
Yes, please do. But before we go, there is a silver ring that we found here in the first row. So if it's yours, please do come collect it. Thank you very much, everybody, and see you in the bar upstairs.